Welcome to the Heart Rate Variability Podcast. Each week we talk about heart rate variability and how it can be used to improve your overall health and wellness. Please consider the information in this podcast for your informational use and not medical advice. Please see your medical provider to apply any of the strategies outlined in this episode. Heart Rate Variability Podcast is a production of Optimal LLC and Optimal HRV. Check us out at optimalhrv.com. Please enjoy the show. Welcome, friends, to the Heart Rate Variability Podcast. I am Matt here back with you, and I'm really excited for our guest today, Dr. Stephen Paliakas, who really helped me pronounce that name and allowed me to call him Dr. Steve from now on. So I'm really excited, Dr. Steve, to have you as a guest to explore a little bit. Like, I got to get a little bit into your story with your introduction because it's just so fascinating, your experience. And then really looking at how you've integrated HRV, if I am getting a good gist of you, both into your chiropractic care, but also really a holistic approach to wellness. It seems like your work in your clinic really spanned a really cool depth. So I'm really excited to explore this all with you, but I'd love for you to introduce yourself to our audience.
Yeah, great. Matt, thank you so much for having me on. It's such an honor to be here with you guys in the HRV community. So, I was just wondering, how did I get here professionally? And I guess it goes back to I got into chiropractic as a kid. I had radical severe sinus infections, and the worst one, I was hospitalized on IV antibiotics for a few days. I was 15 at the time, and our ENT, Dr. Bolger, told my mom, can't explain why this keeps happening. And he said, seek out something alternative, because all I'm going to be able to do at this point is just throw antibiotics and treating symptoms. So my mom had encountered chiropractic, and these guys will sometimes make some pretty bold claims. So she took me to a chiropractor as a 15-year-old, scared the crap out of me, as he was adjusting my neck, but I got comfortable with it. And after a number of sessions, the doctor had determined that the curvature in my neck was reversed the other way, and I wasn't draining properly. So it was just a pure mechanical issue. And this is probably in Dr. Dave Hopper's wheelhouse too, what I was dealing with. Right. So anyway, the short of it is, and I'll never forget, a few sessions into chiropractic, because I didn't have a lot of pain in my neck. I'm like, I just feel different. I feel really good. And I couldn't really articulate that further, what I was feeling as a 15-year-old. Flash forward, I ended up seeking this out as a profession because it had helped me tremendously. And my first clinical experience when I was still in school was with the Salvation Army in Chicago at the Des Plaines Clinic in their drug and alcohol treatment center. And chiropractic interns were functioning as a kind of initial gatekeepers, the guys coming in the program. So we would do blood work, we'd put them on nutritional supplementation, chiropractic adjustments. And as these guys' bodies are completely shot, just helping them kind of restore. And it was such an honor, just looking at the humanity of these people struggling with addiction, and what a privilege it was to be there with these people as they're truly on their bottom, and some of these guys are coming out of prison or off the streets or whatnot, and just how beautiful that was and how that impacted me just as a practitioner. I mean, I look forward to that every day, just to be with these guys. And that also harkened back to something I'd learned in school with a teacher, that what's the number one reason people will call the chiropractor, and people raising their hand, it's because they're in pain. He says, no, it's because they're frightened. That fear is usually the primary motivator why someone will call and go to the doctor, whatever the condition, because you're becoming powerless over this thing. It's bigger than you. And that actually relates too. Got married in chiropractic school, and my wife had it on her heart that, we should volunteer overseas and do some medical missions work. And so my first year in clinical practice after chiropractic school was in post-war Bosnia-Herzegovina. And we spent a year, we worked in an orphanage. I thought I'd be doing more pediatric work. I ended up doing more geriatric work because there was so much humanitarian aid dumped out on the kids, on the orphans. But the elder orphans, there was a major issue there. And so kind of the common thread with being at the Salvation Army clinic and then being overseas in Bosnia-Herzegovina, I really kind of was able to visualize my professional goal of beyond just treating pain and functionality, mechanically, the bigger issue, we're tending to human suffering. We're dealing with people, and that's the elephant in the room with medicine. Is that you're in Western medicine, we've compartmentalized the human being into these little segments, and just a struggle to try to do whatever I can to see kind of the big picture within my limited capabilities as a chiropractor. And I'm a huge fan of Western medicine. Don't get me wrong. There's a time and a place for everything.
I could chime in, and I want to.
Yeah.
We'll pick up from here, but I just have to ask, because as the audience know, my background being in mental health, and I came to heart rate variability through trauma work.
Right.
Way to measure both the impact of trauma, but more importantly, hopefully the journey to post-traumatic growth with folks. I'm interested because I've never seen, and I do a lot of work in homelessness. I just gotta, and my audience will also know this. Really, this podcast is for me to fulfill my own curiosity more than anything else. But I love to hear, because I rarely see a place like Salvation Army where a chiropractor is even available to folks.
Right.
Like that's maybe, and we've done a little bit better with the Affordable Care Act,
Right.
getting traditional healthcare to folks. But
Right.
I'd love to hear just a little bit about your experience as a chiropractor and as one of the initial contacts for people coming into the Salvation Army, because I've never seen that model in decades of my work.
Yeah, it was pretty incredible. So, and I strictly dealt with men. So the men and women are separate in the Salvation Army. So men who would enter the program, their first day would have a physical. When you get the history on what their drug use or alcohol use was, we would do HIV testing, and it's the nutritional company Standard Process out of Wisconsin. We had access to their whole product line. And so it was really just, how to say this, the natural first concept that Salvation Army was applying there. I mean, we were definitely refer guys out that needed to go to some cases. They needed to go to the ER. Some of them were beyond. They needed to follow up with an MD, and so we had those referrals and that system in place. But screening those people out, in most of the population was incredibly open to that. They're trying to get their lives back together, proper diet, proper hydration, proper exercise, or not even proper, just get some diet and exercise and some hydration, and change your lifestyle. So the program is still ongoing, and it was set up through the National University of Health Science, where I went to school, formerly the National College of Chiropractic. So
that's awesome.
Yeah, so circling back to HRV and why I'm super excited about having this as a tool in the clinic. I do acupuncture as well. So I'm an acupuncturist as well as a chiropractor. So not every patient is a chiropractic patient with me. Not every patient is an acupuncture patient. Most people are getting some version of an integration or a layering of the two paradigms, and that's kind of cool too. When a patient's coming in, that's when they've kind of fallen through the cracks of the medical system, or things even clinically on orthopedic exam, or it makes no sense why they're complaining what they're complaining. Well, let's layer a different model on top and a different strategy. So I've been telling patients since the word go that chiropractic and acupuncture is going to help their nervous system self-regulate.
Yeah.
Right. And when I learned through, actually, Dr. David Hopper, Optimal HRV, gave a presentation through the Illinois Chiropractic Society. When I saw that talk come up, I missed it. I'm like, oh man. So I eventually got on a recording of the call, and my head just exploded, because to be able to take a reading on somebody pre-treatment, get their HRV, and then get a reading post-treatment, and to see that change, for me, that's a huge game changer. And I run into a situation from time to time with patients where, let's say they're coming in the door and they're rating their pain. maybe a 5 out of 6 out of 10 walking in the door, right? We do the treatment and they're done. They're getting them off the table. So how are you feeling? Oh, great, doc. I feel fantastic. Really? Okay, well, what's your pain number? 4. What? Your pain dropped down 1, maybe 2 points at best, and you're telling me you feel fantastic? Yeah, I feel great. So now I can understand. Now we can quantify that a little bit.
Yeah.
Now it's also a great tool. Patients for whom I'm pushing in treatment, just like when you're exercising intensely and your HRV's got to drop, you'll see that drop because you push yourself hard, and then you see your numbers bump up later. Same thing in the practice. It's a tool that can help me kind of gauge, where I should be going with the patient clinically, and be pushing too much, or are we dialing in? So I'm still on the learning curve. I've only been doing HRV in the clinic going on 6 weeks, little by little, but thus far it is a game changer. And I'm putting the brakes on because the temptation is to say, I may not treat you if I don't have baseline data on you on your HRV yet for a few weeks, right? Because one reading by itself is meaningless until we start to see those trends and such. But it's kind of funny how I got into HRV. Circling back to treating human suffering, I encountered the work of it was a Canadian public television did a documentary called Laughology. And it was really fascinating. It's sort of the neurophysiology of laughter. And one of the takeaways was, the name of the researchers out of Berkeley escapes me. Albert Nurnberg is the gentleman who put together this program. He was an investigative journalist. And the short of the documentary is that though humor is cultural, laughter is universal. And they talk a little bit about when people are in a group and they're laughing, in a sense, our brains are kind of syncing like on the same Wi-Fi. And they talk about kind of the cultural component to that, but then the neurophysiology that's happening with laughter, you're getting the exact opposite hormonal cascade of stress. You're getting vasodilation in the immune system. So I thought that was really interesting. And I observed that clinically, like when I'm treating a patient, I've over the years have developed using a lot of humor in practice, a lot of laughter. In the old Reader's Digest, they would have laughter, the best medicine. I grew up reading with that. And my clinic had just kind of organically, integrated that. And I try to have a patient, when we're doing a patient encounter, particularly if I'm doing something that's painful, dry needling, or if I'm stripping out a muscle and they're hurting, ask them if they've heard any goat jokes lately, or crack a bad dad joke just to kind of diffuse the mood a little bit. But that understanding of the role of laughter tipped me off also to the work of Dr. Stephen Porges and the polyvagal theory. And that was a huge game changer professionally as well. And so how the role of the vagus nerve, the social vagus, is helping balance out autonomics, parasympathetic, sympathetic. And I do a lot of acupuncture in the ear. I've always done a lot of ear points, and that's heavy vagus stimulation. And so, again, learning with HRV, we can kind of start to peek behind the curtain a little bit and see what their vagus is doing, and not just sympathetics or their parasympathetics, but how the whole system is bouncing back or lack thereof. Wow.
Yeah, I would love to explore, because to me as a lay person outside your areas of expertise, I in many ways see acupuncture and chiropractic care as very different. And again, forgive my ignorance of your expertise, but almost soft tissue work versus structural. I don't know. You hear chiropractic care, at least in my experience, in a way that acupuncture. I imagine if you hear any sounds like you do when you're adjusting somebody in acupuncture, you've done something very wrong. So but really looking at how like the polyvagal theory kind of crosses over those two very different sort of approaches to health and wellness.
Right. And many of us coming from diverse disciplines, we have our hands in the same cookie jar, which is really, not to say that we're doing the same work, but we're dancing around the same elephant, so to speak. So in the state of Illinois, the chiropractic scope of practice is the diagnosis and treatment of human ailments without prescription drugs or surgery. So first off, I've got a pretty broad scope of practice. Um, so yeah, that intersectionality of polyvagal and acupuncture and chiropractic. Well, help me out here. Dial in the question a little bit better because I'm losing. I don't know where to go on answering that because that's
really
kind of
like
broad.
Interested in, obviously, well, at least I won't say obviously, but I'm assuming that in many ways both your chiropractic care and your acupuncture, that there's probably some level of what you're trying to do with the autonomic nervous system that crosses over both. So I guess I'm looking for, if you think about the Venn diagram
Right.
of where both acupuncture on one hand,
Sure,
and a chiropractic care, both sort of impacting and improving autonomic functioning. And
yeah,
I'd just
okay,
like
great,
explore
yeah,
how
yep.
those two overlap from that polyvagal perspective.
Okay, so let's just talk about the crossover. For example, spinal manipulation of the atlas C1. There's research that was done on the University of Chicago that it would drop blood pressure. Same thing, temporarily, right? Doing manipulation of the thoracic spine. You can adjust somebody to get their sympathetics to fire. You can also adjust somebody to, and depending where you're going to. So structurally, if you want to spend time up in the sacral plexus or the parasympathetic plexus higher up, or the sympathetic plexus along the thoracic spine, depending upon what you're doing with what intensity, you can get the sympathetics to start ripping off, or you can get the parasympathetics to engage, and I guess activate some vagal brake, right? So, and the same with acupuncture, depending upon the points. Well, I guess one commonality also is the patient's laying on the table. They're calmed down for 15, 20 minutes or half hour. They've been out running around, driving through traffic. That's one commonality for sure. So you can do acupuncture points to, again, activate the sympathetics. We don't do too much. Most of the time you want to put somebody in more of a parasympathetic rest and digest, tissue repair, healing mode, right? And that's by intent. So in terms of polyvagal activation, when a patient's supine and we're working points, say, doing some manual therapy on the suboccipitals or maybe some craniosacral, that light touch, correct me if I'm wrong, there's a branch of the vagus that goes into the ear, and in the social vagus, it's also going to the eye, the facial muscles, our voice, throat, lacrimal glands. But it seems that possibly light touch in the suboccipital area somehow is by stimulating the parasympathetics up there is maybe spilling over into there. I don't know. But in the clinic, also, when a patient's there, we're doing some laughter, the patient's talking, we've established a safe environment. And that's number one when a patient's coming in, regardless. And I have no idea what trauma, your wheelhouse, people walking in the door, a good history who helped get there. Sometimes people don't bring it up in the initial history because they're not comfortable. And, but that's still present in the room, And so, I'm doing direct stimulation of the vagus. Also music. We play a lot of music in the clinic.
Very cool.
Yeah, but certain kinds of music that are gonna, that seem to resonate with the polyvagal theory as well. So that and laughter, a lot of talking, and just helping the patient know they're among their tribe now. That this is, they're in a safe place. So, I don't know if I even answered your question.
Yeah, out of curiosity, what's your soundtrack that you use? I'd be curious what music you play in your office?
So, have you heard of the Anonymous Four?
I have
So
not.
it's a female a cappella group. They have some really obscure medieval music. That's all female voices doing first, third, fifth, seventh harmonies, and it's just
Very
real
cool.
simple music. And they've got some other things. Do a lot of instrumental music and kidding around. This is another discussion for another day. We also will play therapeutic polka music on Fridays for 20 minutes because when you listen to polka, you're forced to make a decision. This relates. So when you listen to polka, you're either going to get a headache because polka is silly music. It's a 1, 2, 3 beat. It's a waltz sped up quickly. It's inherently silly music. You can't take yourself seriously when you listen to polka. So you're either going to get irritated by the polka music for 20 minutes and it'll start to act as a counter irritant. It'll get some form of nociceptors firing somewhere in your system, and that's going to gate the pain that brought you in the door. Or you're going to get happy and join the silly party for 20 minutes with the polka music and laugh. So in either case, you've either gated the suffering temporarily or you've distracted them and switched them over to polyvagal happy silliness with some other people. So for at least 20 minutes, you've helped them.
I don't know if you're safe when this goes live because you're very close to Wisconsin. And I've met some Wisconsin folks that would maybe take some exception to polka not being serious music. But
hey, no, and I would say to our Wisconsin brethren north of the cheese curtain, happy music for happy people. That's all I'm going to say.
There we go. Maybe a little drinking involved in my experience.
Bring on the polka revolution.
Gotta love the cheeseheads up there.
Yeah, for sure. Sure.
As somebody who's new to this, with your really amazing kind of story that you've led to get to where you're at, and now really thinking about, it sounds like at least you're thinking about how to integrate this more HRV more and more
right
into your practice. I just kind of, as you look into the future, maybe a year or so, as you continue on this learning curve, what do you think the possibilities are for HRV integration?
Oh, fantastic question. So I love the clinician dashboard. So I can follow up and have continuity with people who are, we've met their treatment goals. They're done with care. I've given them a tool, to help them for self-management, because that's the ultimate goal with what I'm doing clinically is resilience. We want to build resilience to help them with whatever the trigger or the injury that brought them in the door, right? So where I envision this going is long-term is having continuity with people that I'm treating this month for whom I discharge from care, to follow up with them and encourage them, to increasing their, as they learn the resonance frequency, they're doing their breath work, they're doing their HRV training. I want them to have, I don't want them, I just want to have delivered them a clinical Band-Aid. I want them to have a tool in their toolbox so that they can chase improved quality of life, after encountering me, right? So that's really my end game. And in my other motivation for bringing HRV is, man, how can I help? How can I be of greater service to people beyond, what I'm doing, chiropractic acupuncture? The elephant in the room is the stress that's everybody's under, the relationships, those things, your lifestyle. Are you drinking your water? Are you, having a bender every weekend and wondering why you're on, why your HRV numbers have tanked, right? So there's incredible applicability that, if my intent is really to help somebody, it's beyond just helping with their pain, So that's where I envision this going, and increasing patient satisfaction. I've got chronic pain patients already that I've given them a tool, and that they, they're doing their breath work, their resonance frequency training, and the stress and anxiety that the suffering and the pain itself is causing. This is one way to help mitigate that and help begin to take little, micro steps day by day to, they're setting a goal, and let's help you get there,
Love it.
So there's so many applications for this clinically.
Excellent. So this is the part of the show where Matt just asks questions that Matt's curious about, which may go way off the track, but I always seem to, talking to folks like you, have just that spark kind of my interest. And one of those is like, and again, I'm stepping out of my comfort level here. So you can just say, Matt, you are way in left field.
All right.
Basically, your question makes no sense, but I've been really fascinated, and so my assumption is that acupuncture is based on traditional Chinese medicine, which I think I'm pretty
Yes.
safe. While there's been a lot of research to expand on that,
Yes.
coming out of that, really, I don't know how many thousands of years of tradition I'm somewhat familiar with, enough to be dangerous. But I always find, which I believe with the Chinese medicine, all the channels and the qi and those sort of things that I find really fascinating. While it's not a one-to-one correlation by any stretch, that there seems to be so much intertwined with that the wandering of the vagus nerve all over the body, and
Right.
some of the stuff that we're seeing with Chinese medicine dating back thousands of years. And I just kind of wonder, as you start to, get expertise, building expertise on polyvagal theory, the vagus nerve, do you, as you look at those chi maps and Chinese traditional medicine, do you see kind of the traditional and the modern coming together in any way that kind of resonates with you?
Yeah, that's a great question. So traditional Chinese medicine and Western medicine coming out of the empirical model out of Western Europe, basically going back to then to the Middle East. It's interesting. They're radically different. It's a radically different worldview.
Yeah.
Right. There's some intersectionality and there's some congruences there. The most obvious congruence is the neurovascular bundle. If you look at the embryologically, brain, come on, brain, endoderm, mesoderm, I forget which of the derms it is. That's the cell line. Then the neurovascular bundle comes out of. Interestingly, the channels, meridians, whatever you want to call it, tend to correlate and overlap with that. Not perfectly, not one-to-one, but generally there's some congruency there. That's really interesting. The fact that you can measure changes in voltage potential over acupuncture points, that's really interesting.
Yeah.
One of my acupuncture teachers, in shame on me for not doing a deep dive pursuing this, but it was really interesting that basically we're a closed biological circuit, and was explaining kind of how the closed biological circuit. And I'm not an electrical engineer, and this is beyond me, but yeah, it parts of it do make sense that we're living on a giant magnet core, planet Earth. We're living on a ball of iron in the middle, and kidney one, when that's on the bottom of your foot, when during your gait cycle, as interestingly as your body is powering up for the gait cycle through the kinetic chain to propel you during gait, that's also kidney one, which depending upon your style of acupuncture, that's where you want to set the starting clock for the circulation of the chi through the meridian and the channels there. I'm a Westerner. I don't talk a lot about yin and yang and chi in practice, though we'll still evaluate that. But I don't want to confuse my patients, and I want to help them have as much buy-in as possible, as opposed to giving them a diagnosis of, well, you have too much wind in your liver.
Yeah.
What? Well, we don't literally mean wind, and we don't literally mean your liver. So
yeah.
Yeah, what's cool, geeking out on that a little bit is, when I was in school 20-something years ago, I was taught that acupuncture originated in China. They've since discovered archaeological evidence of acupuncture in India predating the Chinese.
Oh, really?
And after that, they discovered acupuncture in Egypt that predates the Indians. So this has been around for a lot longer. And interestingly, within the indigenous peoples in North America, the Dakota people, when a woman is in labor and part of their traditional system, they will stimulate in the little toe, a point right here, which you'll sometimes stimulate to get uterine contractions going for women who's maybe is late term. So this has been around for a long time, and maybe anecdotally, it's as simple as, "Ugh, I have headache. Put deer antler here, headache go away." Who knows, But it's really amazing. And even Dr. B.J. Palmer, the developer of chiropractic, he spent some significant time in China and developed some of his concepts with chiropractic that were influenced out of traditional Chinese medicine. So there's definitely crossover, right? But yeah, it's just remarkable. The human body is such an incredible, the human system is such an incredible system. It's it's endless, right?
Yeah. Fascinating.
So
Yeah. I love that. I never knew that it kind of makes sense that it predated. I guess, my study of Chinese history, does anything predate Chinese history in a way that history got passed on through?
Right.
I'm a very diverse when we think of China today, but just such that connection long into history and prehistory with that. So I know India has similar long histories and culture as well. So very fascinating.
For sure. Yeah.
That history. And we usually find things that work, and that's where this is really exciting to me, because I think it's that connection where things we might have considered. I don't love complementary medicine. I think it undervalues some of the stuff that we're really trying to do with it. But it's really how these pieces integrate together, and the fact that heart rate variability can give us feedback on really what is working, and ask new questions. What is a pre and post acupuncture reading for folks, chiropractic care for folks, or just in Western medicine, if I got a prescription medication to help me be healthier, is it working? What's it doing to the autonomic nervous system? And it's those questions that until the last couple of years, when we could put this on everybody for an affordable price without having a huge computer in your bedroom to hook up to an EKG machine, we couldn't really ask in the way we're asking now. So I'm really excited to see where you'll go with this as well.
Same here. This is such an empowering tool, for myself as a clinician and patients too. I'm excited to see how patients who follow up with their HRV training long term, how that's going to affect quality of life, and not just pain and not just stress, because that's going to have getting better balanced out autonomic function. That's all of your abdominal organs. That's everything. So I think what you guys are doing with optimal HRV is just incredible, and I think kudos to you guys for what you're doing. You're impacting lives.
Thank you. Well, that is huge. Thank you for that. And I working with folks like you, because that is why I started. I honestly, when I started out this journey, I never thought I'd be having these sort of conversations. So it's so fun to work with folks like you. And from the mental health perspective, and it sounds like you can kind of see, especially now that we got the biofeedback aspects in there, and Ina Hazan's work in there with resonance frequency breathing. It's like, what do you do between sessions? And we always when I go to chiropractic, I got stretches, I got my homework. I love my homework as a therapist. We're going to make you a journal, do other things, but we're all working to help in some aspect. You could throw the mind on top of this system and other things, but we're really trying to help heal and build resiliency in that autonomic nervous system. And I can't think of a better homework to give people than, resonance frequency breathing, to supplement everything else you do already in your practice.
Right. Yeah. And I'm really intrigued also how HRV is used within the realm of sports medicine, athletics, I've become an avid runner over the past year, and how improving your HRV is going to have some beneficial impact, at a minimum, some, it possibly dramatic impact also on your cardiovascular function when you're, doing prolonged exercise.
Yeah.
So there's so many applications for this. It's just that, I tell patients it's like another gauge on your dashboard.
Yeah.
And I don't use BMI. I mean, BMI is a relevant metric in some sense. BMI, doesn't make a lot of sense for somebody who's body morphology, So I'm using now. I also use VO2 max as an indicator for patients, and because I also do a fair amount of anti-aging. I have a vested interest in this. I have 5 kids. I want to be around. I want to be around to go running with my grandkids. But when we talk about longevity, I think tracking your HRV, there are so many applications, because HRV can be used so much for your lifestyle, healthy lifestyle or lack thereof, that if you track your VO2 max for your cardiovascular function and set a goal of, I want to maintain my VO2 max where it's at, or I want to bump it up 1 or 2 points this year, even though I'm 53, whatever, set a goal. And if you're going to do that, it means you're building into your lifestyle cardiovascular exercise. You're going to be doing, the right kind of cardio where you're going to be, it's good for cognitive function, slowing decline, anti-aging, working you can use HRV, theoretically to gauge how your intermittent fasting is going. That, how about that?
Yeah. And it's, as having really been on this now for, 3 years every day, probably 4 years, even before I started Optimal. It's like, you get to really that fine tune. So it's like, does intermittent fasting work for Dr. Steve? Does it work for Matt?
Right.
Because we're going to have different, maybe you're a 16 and I'm a 14,
Exactly. Right.
Maybe I'm a long hiker, walker, you're a runner. And, I probably, for both of us, more than a couple drinks, probably, I've pretty much given up alcohol because of, not because I've had a problem with it, but
you see what it does to you.
Yeah,
it's like,
you see what it does, and it's like, is it worth it? And my answer was no. And
not so much.
Occasionally, sure, but it's rare and far between, because I know what the next morning is going to look like. And I'm fortunate enough to really look forward to what I'm doing, whether it's work or on the weekends the next morning. And it's just like those things, sleep quality, all those things. It's a great metric that doesn't necessarily will pull out and say this exactly does that. But boy, once you do it enough and then you make those tweaks, it really helps you see the power of that in your own life, which I think is just like such a fascinating thing personally. And I think about those, to kind of come full circle to those folks you were working with at the Salvation Army, with all that trauma and addiction, homelessness. Like you talk about nervous systems that are so resilient in one way because they're surviving stress that I know personally, their stress on a typical Monday is going to probably outweigh any stress or trauma I've ever experienced in my life. And yet they wake up every day and face life. Yet, what's that wear and tear? And my hope is that we can start to document, when we do get them help, what does that do to heart rate variability? How can we show that a program like yours actually helped to heal all that damage done by the nervous system? Where we have some real data where we can advocate a program like that nationally or internationally, because I love that piece. But collecting data on it has always been difficult in our field because of the scaling stuff that we use. Like, I feel fantastic. You dropped my pain by 1 point. Like, let's now we got some more quantifiable, objective data to really see, which is to me so exciting of where we're going in the future.
Yeah, I see this as a is super tool to help accelerate a person's healing. If you know the right things to do, the body's got it built into it, natural healing mechanisms, and if we can just help read our own dashboard a little bit better, so we know, where to go. Right.
Awesome. Well, am so excited to take this journey with you. It's an honor
Yeah,
to have you
so
on the
great.
app. And
Yeah, thank you for having me
as
on.
you go along your journey, I would love to have you back and really learn more along the way. Because again, I think, it's interesting when, being in obsessing about heart rate variability really for the last 5 or 6 years, it's sort of the water I swim in. But as you know, even chiropractors who probably maybe the leading as far as professionals outside biofeedback folks that are aware at least of heart rate variability, you quickly become a pioneer in this by adapting in the way you do. So I'm excited to learn from you, your experience in, and it's just great to take this journey with you.
And it's so great to be on this journey with you, man. Thank you so much.
Awesome. So I'm going to put a little bit of information about you and your work in the show notes.
Okay.
Just if people, maybe we got some Chicagoland listeners that might want to reach out. Just tell them a little bit about your clinic and maybe give your website name. And again, we'll put all those links in the show notes.
Yeah, great. So I'm in Wheaton, Illinois, so western suburb of Chicago, not too far from the DuPage County Courthouse. May you never have to have spent time there. Our website is acupuncture-wheaton-chiropractor.com. I also created an easier website, just www.injurydc.com. A little easier to remember. Yeah, we're primarily chiropractic and acupuncture, rehab-based chiropractic. So heavy into exercises and stretches in clinic and at home as well. Do a fair amount of dry needling. And we have red light therapy here as well, and adaptive contrast exercise with oxygen training as well. That's a whole other can of worms there. So, yep, if you're in the Chicago area, love to hook up.
Sounds good. And again, we'll put those links in the show notes so everybody has them. But Dr. Steve, thanks so much for joining us. Great honor to have you.
Oh, thank you so much. This is so much fun. Yeah, such an honor to be here. This is great.
Well, we'll get you back soon to learn how your journey progresses.
Sounds great. Okay.
Thanks everybody. Man. And as always, you can find show notes, everything else at optimalhrv.com. And we will see you next week.